Linda, just tell me your name, and if you remember the surgery date, give me the surgery date and what the surgery was.
Okay, Linda Gandels. My surgery date's February 15th, 2017, and I had the gastric sleeve surgery.
Great, and who was your surgeon?
Dr. Ramlogan.
Awesome. Tell me a little bit about that experience.
Well, I had a big bad experience with my gallbladder many, many years ago, and I thought that it was going to be the same experience, but it was far from it. And Dr. Ramlogan told me, don't worry, don't worry, don't worry, and he was absolutely correct. So I saw him right before the surgery, and I said to my husband, here he is, like the rock star, Dr. Ramlogan. And he said, don't worry, everything's going to be fine. And everything was better than fine. I woke up in the recovery room feeling good. My husband was stunned because he knew how nervous I was. And my recovery was like, pinch me, this is too good to be true.
Wow.
I had no nausea, I had no vomiting, and I'm a puker. And I got out of bed, no problem. I mean, I feel so happy already, and I'm only 2 weeks out, and I'm down 24 pounds.
Wow, congratulations.
Yeah, and people are noticing. It's so much fun.
Pretty great. Have you changed like some of your eating habits, or has anything been affected like that?
Well, I'm a foodie, and I'm a cook. So I'm like, how can I make this fit? And for the first couple days, it wasn't fitting in my head because I'm not eating anything, right? We're doing clear liquids.
Mm-hmm.
So I got myself a set of little baby bowls with little baby covers and little baby spoons and little baby forks. And it's fun to eat my little bitty food in my little bitty bowl, and my husband thinks it's hilarious. And I'm going to make this all about working for both of us because the journey is for both of us. Mm-hmm. You know, his kids are grown. I don't have any. So I got him to quit drinking. Mm-hmm. He's on the wagon with me. So it's going to be fun to see where we both end up.
Did you originally come to one of the seminars?
I did.
What were you thinking when you were in the seminar? Like, what was going through your mind? Because that's the starting point for all of our patients. And sometimes I wonder just kind of where they're at. And I know everybody's different.
I looked around the room and I thought, wow, there's a lot of heavy people in this world. Yeah. And I know that there was a certain weight where I stopped feeling just fat and where I'm like, oh my God, how did I get to this point? Mm-hmm. And when Dr. Ramlogan gave his presentation, I just felt so comfortable with his way. You know, he was so easy and funny instead of it being like, this is so serious because you're morbidly obese and you're going to die. Mm-hmm. You know, it wasn't like that. It's like, because we are all sitting in this room morbidly obese, right? Mm-hmm. So what can we do to change that? You know, so now I got the tool. And
were you scared?
A little bit.
Or had you already made the decision?
Oh, I already made the decision.
Okay.
One of my friends had the surgery here with Dr. Shea. So,
okay.
And she lost 180 pounds in 1 year.
Wow.
So she was kind of my inspiration.
That's amazing.
Yeah.
So then just tell me what your goals are, like what you hope to achieve and what do you hope to do? My
goal is, I have a goal weight in mind, but my goal is to get off all my meds. I'm not there yet because I've been fighting with blood pressure for a while, but I would like to get off all my meds. Obviously I would like to weigh less and look better, but I just want to be healthy because there's things that my husband and I want to do together. And I think at the weight I was at, and my high weight was 292 pounds. My surgery weight was 267. So there's things that we want to do together. I want to take a trip to Antarctica someday and walk on the glaciers with penguins. So I wasn't going to do that as a fat girl.
And then tell me what you told me when I first came in the room that you guys are going to do, the three of you.
Okay, so when I first met Dr. Ramlogan, he was asking me some of the reasons why I wanted to have this surgery. And I said, I take up too much room on my husband's Harley. And he asked me, he goes, do you think when you get down to your goal weight that you and me and your husband can fit on his bike? And I said, oh, count on it. And I said, I want to be your poster child.
That's great.
Yeah.
So I hope to get that on video too someday.
You know, that would be really cool.
Be amazing.
But I know it's a silly little thing, but it's like when you're the fat girl on your husband's bike, and you know the last bike we had, it was a little bit smaller, and this one's a little bit bigger. He finally found his right ride, right? And I want to be a spinner on the back of the bike. Mm-hmm.
That's absolutely
It's a little bit of an ego thing because I'm a little bit older than him. So,
thank you.
You're welcome.